Good afternoon, everybody. I hope you can hear me just fine. I think most of you are muted, so if you have any questions after this, definitely you can talk to your care manager. If you are on a phone or if you are able to mute yourself, if you don't have it muted already, that would be great. So my name is Connie Lord. I am the Director of Nursing here at Custom Home Care. And I thank you very much for joining me today. I think somebody, I'm so sorry, somebody needs to mute. Okay, thank you. We just don't want to have a lot of different people talking at the same time. This talk will not take that long, maybe about 10, 15 minutes. We really feel that it's important to gather together and chat a little bit about what's going on right now. We are right now starting our, whatever you want to call it, second wave of COVID. And it is so important that we do our due diligence in making sure we are all as safe and healthy as possible. And that really starts with you. So just talking about what's been going on, we understand that there is such thing as mask fatigue. We are tired, as everybody in all of the world is going through right now. We're tired and we want to go back to normal, and we don't know when that will be, but right now we have to stay safe and do what's best for ourselves and our clients. So that being said, you know, we need to really reiterate our policy that our caregivers, you all, are wearing your masks at all times with your clients. This is not something that we are there's no question about this. It's got to be done, okay? There are times when you could be a silent carrier of COVID and you cannot bring that to your client. They say that, you know, COVID is one of those things where you get it from somebody. It's not something that you're born with. It's not any accident. Somebody gives it to you, and we cannot bring COVID to our clients because they're the ones who are most vulnerable. They're the ones who need our help, and we have to be as vigilant as possible. So, you know, we understand that if you don't wear your mask, that it is a violation of our policy. We need you to understand that. We need you to understand the importance of this and that we are taking it very seriously. If we find that you are not wearing your mask, there will be cause for termination. And we don't want anyone to be losing their jobs in the middle of a pandemic. So please do your best to keep with policy. It's very, very important. We had a case recently where a caregiver was found to be positive, and then it turned out that the client this caregiver was with is also positive. So we don't know who gave who the virus, but you know, it's more than likely the client received it from somebody that came in. So more than likely it was either the caregiver or somebody else that brought it to her. So we have to be very, very careful. Found out also that the caregiver was not all the way truthful, and found out that the caregiver was not wearing a mask at all times. So unfortunately, the caregiver will not be able to be working with us anymore. So again, this is really serious stuff, you guys, okay? I need to also mention that, you know, we are essential workers. They rely on us to be there for them. We need to be there for their day-to-day activities. We need to keep them safe. And so we need to keep ourselves safe, okay? We also need you, besides wearing your mask at all times, you need to be, of course, washing your hands. When you walk into the apartment, you're washing your hands. When you do any work, you're washing your hands, or you have your hand sanitizer with you when you don't have soap and water. It is also really important to help your client wash their hands. That is something that sometimes they are not thinking about, or they are not doing 20 seconds of it. So we need to make sure we're helping them wash their hands. Then we wash our hands right after that, okay? Any kind of personal care, you're going to be using gloves, of course. You're going to be washing your hands before putting the gloves on. You're going to wear the gloves. You're going to do your care. You're going to take the gloves off, and you're going to wash your hands again. We have to make sure that whatever we're touching, we're eliminating the chance of the virus being spread, okay? The same goes with surfaces, you know, taking a Lysol or taking some kind of cleaner and wiping down all surfaces that get touched frequently. Absolutely, too, includes your phone. I say this to my kids all the time, you gotta wipe your phones down. So please do that as well. When you're wearing a mask, it's gotta be the KN95. It is the best protection for you and for your client. I understand that sometimes it is hard to understand, but we have to do our best and try to figure out a way to speak louder or get our information across as best as possible. We can work with you regarding this. We can, you can talk to your care managers and see what other things that we can come up with to help you get your information across or communicate with your client better. So we need to make sure that we're wearing those. If you need them, of course, see your care manager or call the office. We're happy to make sure that you have everything you need to be as safe as possible, okay? Another thing I want to mention is it's flu vaccine time. You guys, it's super important to get this flu vaccine. I know I've spoken with people who feel like they get sick from the vaccine. You know what? That might be a day of not feeling well from a vaccine, but you will be fine and you will be better for it. It is another little, safety measure between you and COVID, or you and the flu, or you passing it along to somebody else. So please get your flu vaccine. If you need a place to go to get it, or if you're wondering about it, call the office, talk to your care manager. Happy to do that with you. And of course, you need to make sure that your client is getting their flu vaccine as well. I mean, advocate to them. This is really important. It's just another safety measure for them to stay as healthy and safe as possible during the season, okay? Please do communicate any concerns with your care manager regarding PPE or in the health of your client. If your client becomes sick, we need to make sure that we are communicating at all times, and that goes for you as well. I mean, we need you to maintain your health as best as you can, making sure you drink your water, you've heard it all, eat well, get your rest. And if you are not feeling well, please just call us, let us know. Also understand too, if you're not feeling well, you may receive a call from us. Just want to check in with you, see how you're doing, and make sure that we are keeping everybody as healthy as possible, okay? The one thing too I want to mention is that we are really pushing to have everyone get a COVID test weekly. If you are working in certain buildings, you already know that you get a test weekly. We are working on having that available to all of our buildings and all of our caregivers as well. So you will be seeing information, or your care managers will reach out to you to let you know what's going to happen with that. If you do feel like you have any symptoms or you've been exposed to somebody, we have the North Shore Clinical Lab that is over by Lawrence and Kedzie. It's really easy to get to. Let them know you work with us, and they will get a test you, and then we'll find out the results for you. So And then I think, really, besides the masks, I just want to go back one more time and make sure that you understand the importance of all the PPE that you need. If you are doing any care, that maybe you're helping somebody in the shower and the mask is going to get wet, we do provide face shields for you all. If you are working with somebody and you feel the need to also get a gown, we have those as well. So please, please reach out to your care managers, call the office, and let us know what it is we can provide you with, okay? And help keep you safe and help keep your clients safe. This is the really important part of this. They rely on us heavily. Without us, they can't do their day-to-day, a lot of them, and their family can't visit. So we are their family, we are their guardian angels, and we need to be there for them. So thank you so much for coming and being a part of this meeting. If you have any questions, please reach out to your care manager or call the office. I know that we can get through this. I can't promise you when it'll end. I wish I could give you a date, but you know what? We can do this. And I want you all to be healthy and safe and know that we are all a team together and we're in this together. So thank you so much for coming, and you guys take good care.
You too.
Thank you,
Thank you.
Connie.
Thanks, Connie.
Bye.
Thank you.
Thank you,
Thank
guys.
you.
Bye.
Bye.
Bye-bye.
Bye-bye, Connie.
Have a good
Bye, you
one.
guys. Take
Thank
care.
you. Bye.